Question: what is dental licensure? Answer: dental licensure is the process whereby a state grants someone the legal authority to practice dentistry in that state. Typically, fourth-year dental students complete specific requirements to obtain their dental license. These specific requirements are divided into three categories: educational, written, and clinical. 1. Educational. All states' educational requirements are satisfied by graduation from a dental school, accredited by the Commission on Dental Accreditation, or CODA. 2. Written. All licensing boards use the National Board Dental Examinations, or NDBE, to satisfy their written exam requirements. 3. Clinical. There are 4 testing agencies that administer clinical exams on mannequins and live patients. A. Central Regional Dental Testing Service. B. Commission on Dental Competency Assessments, Western Regional Examining Board. C. Council of Interstate Testing Agencies. D. Southern Regional Testing Agency. Question: so are students still required to practice on live patients for the clinical examination requirement? Answer: it depends on the state the students will practice in following graduation, and thereby the testing agency the student utilizes. Examinations requiring live patients are falling out of favor due to a variety of logistical and ethical considerations. Dr. Nash, an ASDA chair of dental licensure reform in 1971, writes on this issue in an ADA publication in 2021, stating the following: 1. It is not logical nor in the public interest to accept the single episode performance-based or SEPB method of testing and evaluation. 2. Educators and advocates have been arguing for decades that graduation from an accredited dental school and passing the national boards should be sufficient, and is a far more reliable measure of competency than performing clinical procedures in a high-stakes environment on a single day. 4. There is no evidence to support that this level of scrutiny actually protects the public interest. Question: so then, which states require patient-based exams versus mannequin exams? I'm graduating from Marquette University School of Dentistry and want to practice in the Wisconsin area. Answer: the ADA, as do the individual testing agencies, provide dental students with regularly updated and interactive maps of the U.S. that lay out state requirements for licensure. The state of Wisconsin published a licensure rule modification, stating that non-patient restorative examination is approved for 2020 and beyond. Wisconsin requires the following clinical components for licensure: computer-based diagnostic skills examination objective structured clinical examination, or DSE OSCE, restorative on a live patient or mannequin, and endodontics prosthodontics on a mannequin. Periodontal scaling is not required in Wisconsin.